Welcome to Rotary's first World Immunization Week panel. This is a critical conversation about the power of vaccines and their role in protecting communities worldwide. Today, we're honored to bring together three incredible experts in global health: Jessica Malati Rivera, infectious disease epidemiologist and science communicator; Dr. Peter Hotez, renowned vaccine scientist and advocate; and Dr. Stella Anyangwe, global health leader and former WHO representative and Rotary EPNC. Today, they'll discuss the challenges, successes, and future of immunization efforts around the world. So let's get started.
Wonderful. I am so happy to be moderating this discussion with these esteemed panelists. And I know we have a lot of questions to get through, so I thought we would just jump right in. Can't help but recognize the fact that this week is the fifth anniversary of the COVID-19 pandemic declaration. And we have learned a lot, good things and bad things, about the work that is required to do global vaccine rollouts. So, Peter, I'd love to hear from you. I'd actually love to hear from both of you on what are some of the biggest barriers, especially looking back in the last 5 years, to providing vaccine access globally?
Well, I think there are two major big drivers. One one in the area of vaccine development. There was a lot of technologies that were implemented. We went everything from mRNA to particle vaccines to recombinant protein vaccines, to adenovirus vectored vaccines. That was pretty exciting to watch all of the different technologies applied to a single pandemic threat. Um, and they were, most of them, or just about all of them, were very successful. We made a recombinant protein vaccine that reached 600 million people in India and Indonesia. I think the tragedy, though, was the for the newer technologies, um, there was a limitation to how quickly they could be scaled, and all of the mRNA doses, in the particle doses, meaning the Moderna, Pfizer, Novavax vaccine, they got bought up pretty quickly by the high income countries, and it took a while for that to filter to the LMICs. So I think that was a recognition that we need to do better in building vaccine manufacturing capacity in LMICs, and that's starting to happen now. There's been a lot of support now for the African continent, but it wasn't only the African continent. It was, Latin American countries underachieved, the Middle East underachieved. So I think we have to recognize that we have to fix that. And then, of course, the other big disaster was vaccine refusal and or vaccine hesitancy. And that really accelerated, particularly in the United States, and where we saw, according to my estimates, 200,000 Americans. 200,000 is a lot, needlessly perished because they refused COVID vaccines. And in 2021, 2021, 2022, during the Delta and BA1 Omicron waves. And that was not due to just random misinformation or infodemic, as we sometimes call it. It was targeted, it was deliberate. And that we now know that vaccine hesitancy or refusal is now a lethal force in the United States, and I worry that's expanding globally as well. So, vaccine inequality, vaccine hesitancy, two the two biggest barriers.
Stella, what about you?
Yeah, I agree with everything Peter has said. And in addition to that, in the part of the world where we live, it's not only the availability of the vaccine, which is important, but how well the vaccine can reach the populations that need them. So the difficulties in access to vaccines is a big one for us. You might have vaccines in capital cities, but then you cannot get the vaccines to rural areas where there are very bad roads or no roads at all, or where there are no health facilities. I mean, just the possibility of getting the vaccines where they're needed is it's a big problem.
Yeah, I'd love to expand on that because you're touching on a very familiar topic, this concept of the last mile and those hard to reach areas. I'd love to know if you can identify any particular regions or countries that have seen dramatic improvements in public health due to better access and reaching that last mile. And also if you have examples of any that are still too hard to reach or have poorer outcomes because that last mile is just too hard to reach.
In our countries, and I was WHO rep in the Africa region, so that's the region I know best. And I have done the length and breadth of that region. And I know that in every single country, if I may say so, you have some difficulty because when the average says, oh, vaccines are available, they take an average and they don't consider the outliers, those places where you can't get vaccine. We've always wondered, how does Coca-Cola get to the last village and vaccines can't get there? You see, so it just the mechanisms for well, vaccines are not like Coca-Cola. Vaccines need cold chain, and so getting vaccines from place A to place B is a little more difficult than getting other supplies. But still, we have that problem. You asked for examples. I know that Nigeria, for one, they had huge, huge successes in just getting local leaders, traditional leaders, religious leaders, imams in far off places to endorse the vaccine, to say these vaccines are good. And when a population saw that their leaders, their traditional leaders, their religious leaders were accepting for their own kids to be vaccinated, vaccines were accepted. So getting the vaccines there were one thing, accepting the vaccines was another thing. Well, there are still some countries where on the country's budget, health is definitely not in the 15% range like the African country ministers had agreed to have their health budgets being, 15% of the GDP. So supplies, health systems are still not as developed as I should be. And I will not name countries. I mean, I think a whole of the 54 countries in our Africa region, a good more than half of them are still not up to par.
And
I
if
think
I could also add, and this is not just a theoretical discussion, and I think that it's translating into unnecessary deaths on a massive scale. For instance, the IHME, the Institute for Health Metrics and Evaluation from the University of Washington, just put out their global burden of disease for 2021, which includes the deaths from COVID-19. And there was this kind of rumor circulating around that the African continent was somehow protected from deaths from COVID. It's clearly not the case. I mean, the level of death and destruction on the African continent, as well as in South Asia and Southeast Asia, is staggering, and it closely correlates with low COVID vaccination rates in those same places because they didn't have access. And we have to recognize how lack of vaccine access, both due to access to innovation and in some cases vaccine hesitancy, is a significant lethal force globally, and an important security issue.
Absolutely. And Stella, I'm so glad that you brought up the fact that it is not a unique condition. The issue of vaccine deserts exists everywhere. Vaccine deserts exist in high income countries, including the US. And that was something that we had to address in the US during the COVID-19 pandemic for sure. I'd love to talk about kind of the big picture of vaccines, understanding that it is probably one of the top two, if not top, greatest public health achievement in our history with regard to increasing life expectancy. I'd love to know about thinking about the future of vaccines. What are some of the most urgent vaccine preventable diseases that the general public should be aware of? Peter, I'll ask you first.
Yeah, I mean, I think one of the interesting aspects of COVID, and we also saw this with Ebola. The other amazing success story was Ebola in 2019, with that vesicular stomatitis virus construct from Merck and company that really stabilized Central Africa in terms of preventing Ebola in 2019. Is that the power of vaccine technologies? The problem, though, that we face is our ability to develop new vaccines has outpaced our political and social and economic instruments to get them out there. I mean, I feel fairly confident that almost any major pandemic threat now, we can develop multiple different technology approaches to solving those problems. The question is whether there's the political will to support it. So, in terms of the diseases, I mean, clearly, there's the ones where we have existing vaccines for that have been incredibly successful in making certain that we use those vaccines, obviously polio, but also the MMR vaccine. And we've had declines in MMR vaccination rates leading to measles epidemics and even a return of polio in some cases, but also all the new pandemic threats. So right now in the US, a big H5N1 problem in both poultry and cattle, and there's no H5N1 avian influenza transmission between humans yet, but the worry is it's just a matter of time, and eventually that occurs. I don't think we have the instruments in place. We have the technology, but not the instruments in place to get those vaccines scaled and administered. So that's going to be a big issue. You know, we've had now 3 major coronavirus epidemics in this century. We had the original severe acute respiratory syndrome, SARS in 2001, and then Middle Eastern respiratory syndrome in 2012. Now COVID-19 starting in 2019 and just maybe winding down just now. So we know that this is going to be a big issue, and it's happening because these viruses are circulating in bats. Bats are coming into closer contact with people due to climate change and urbanization. So that's going to have to be addressed as well, because I'm expecting we'll have a 4th major coronavirus probably in the next few years, given that current pace. So how we deal with all of these catastrophic cardiorespiratory virus pathogens, and then the others that need attention and that kind of fly below the radar screen because they don't have the same high profile, are all the neglected tropical diseases for which we need vaccines for. So we've seen a big uptick in mosquito transmitted flavivirus and other arboviruses, such as dengue has been exploding in Brazil, and now we're expecting it in Texas and the Gulf Coast. It's also in Southern Europe. Chikungunya, Zika, I worry about the potential return from polio. Malaria is accelerating, and it'll clearly will be a problem beyond the African continent. And then we're working on parasitic worm infection vaccines, hookworm anemia and schistosomiasis. So it's a lot, and it's going to be a matter of managing not only the resources to ensure their development and delivery, but also their acceptance.
It is a lot. And Stella, I'd love if we can lean in on the polio aspect. I noticed your beautiful Rotary jacket, and it's very, timely to be wearing that. But, we've been saying
I'm
we're
actually
this
quite
close.
jealous of that. I want that in a bow tie. So
Likewise, I would love that
appropriate.
jacket. I'd wear it all the time.
I'll think about that. And a bow tie should be nice.
We've been saying in the global vaccine eradication advocacy world that we've been this close to eradicating polio,
Yes.
and it's only endemic in 2 countries. And we have some setbacks that happen every now and then. And the most recent setback happening in Gaza is very tragic to be thinking about paralytic cases emerging again. I'd love if you could speak about kind of what's happened in continent in Nigeria, but also if you could lean in on the concept of herd immunity and why that is such a valuable public health milestone to achieve for community protection.
I mean, herd immunity is something you need to explain to people why everybody or most people in a community should be protected to protect everyone else. So you try to explain to people, if you're 100 of you in this community and only few are protected, there are so many pockets of non-protection that all of you are still at risk. Whereas if you increase the proportion of people who are protected in your community, that big proportion protects even those who are not immunized. So, I mean, people have to understand that being immunized is not only for their good, but it's for the good of their community. So that is that, and we're trying to push vaccination. I, countries, it depends on countries, how people understand, what people understand the cause of disease is, how vaccinations protect it. You have to start from the what people know in their communities as the cause of disease, and why you think vaccines will help them. If people don't believe that a microbe is the cause of their ailment, then something to wipe out the microbe is not the solution to their ailment. So there's a whole lot of sensitization that has to be done for people to understand the concept of causation of disease, and how disease is prevented, and how disease people are protected against disease. So before we start injecting people or putting drops in mouths, there's a whole lot of teaching to be done, a whole lot of sensitization to be done. And many times we don't do that. And we are the valiant knight in shining armor with this thing which will solve your life's problems. But the people don't know what you're talking about. So if you don't do the basics, the groundwork, then your well thought out solutions come to naught because people don't understand them.
I mean, you're speaking my language as a science communicator. I often say, vaccines are not saving lives, it's vaccinations, but a vaccine turns into a vaccination with a trusted message from a trusted messenger.
That's
And so
correct.
the work that has to happen before is significant
That's
and
right.
cannot be understated, and that it is absolutely part of how we increase trust in science by communicating it, because the work of science requires that to get people to make that decision. And I know Dr. Hotez has written and talked a lot about this topic, that the work is not just the R&D and the injection, it's the empathy and the messaging and the one-on-one conversations. So on that, I'd love to address the concept that it seems like some folks maybe normalize disease and illness and say, well, if it's not killing everybody, it's fine, or it could be better for my immune system. I'd love your thoughts and perspectives on how do we communicate the concept of harm reduction, and that pathogens are not your friend, that we shouldn't be getting antibodies and immunity from diseases. We should be getting them from these, antigens from vaccines instead. Peter, I'd love to hear from you about this.
Well, I think, part of this is, the next version of the anti-vaccine movement. That's kind of this convergence of coming out of the health and wellness and influencer industry that's peddling alternatives, and for them to be successful, they feel they have to denigrate the usefulness or the effects of vaccines. And it's also linked to health freedom, political politics. So let's look at the consequences of that. And it's playing right now in the United States. What among the messages coming from the health and wellness industry and the anti-vaccine groups is, one, there's claims that attempt to downplay the seriousness of these infectious diseases, particularly the childhood infectious diseases, and to normalize them, and to diminish the urgency for tackling them, and that's really awful. And at the same time, they tend to exaggerate the risks of vaccines. And the third piece of it is they suggest alternatives, which includes everything from cod liver oil to various vitamin supplements, and then, of course, with COVID, with ivermectin and hydroxychloroquine, which does nothing for COVID. So how do we do that? And I think there's going to be first of all, I think we could do better with our use of infographics. One of the things that I've been trying to do is write some articles where I put two boxes side by side, and in the box is, we look at each box is 10,000 children, and you look at, in one box, you look at what happens if 10,000 children get something like measles, where 2,000 of them would be hospitalized and hundreds or thousands would get measles pneumonia, measles encephalitis, measles deafness from neurologic involvement, dehydration from measles, diarrhea, and blindness. And on the right, the side effects of the vaccines, which are little tiny pinpricks that you can barely see because they are so rare and don't nearly measure up to the severity of measles. So I think those kinds of visuals are helpful. But even that's not enough because, one of the things that's happening is the anti-vaccine groups tend to want to demonize the scientists like myself, or portray us as cartoon villains, or plotting nefarious things in white coats. So how do we restore science literacy generally? And I know that's been a passion of yours. And I think one is, bolstering that in our K through 12 education, pre-university. But also it's on us as scientists and physicians to be more out there in the public domain. My friends at Research America, which is a very good policy group based in the Washington area, conduct these surveys every couple of years. And they ask, this is in the United States, and I imagine it's worse elsewhere. They ask the American people the very simple question, can you name a living scientist? That's the question. And it turns out the numbers are always about the same. 75% of the American people, most Americans, cannot name a living scientist. And when they do, they usually resort to Einstein or Jonas Salk, not realizing that perhaps they've moved on. Or they'll mention Bill Nye or Neil deGrasse Tyson. And I know them both, and they're wonderful people and great educators, but not working scientists in the sense, that are actually in the lab, making vaccines. And that's our fault. I think we have to be more out there in the public domain, and for the American people and for people globally to see us as real people so they understand. I mean, right now, for instance, you've got anti-vaccine groups putting out these horrific pseudo documentaries, and the pseudo documentaries claim that this, for instance, the Tdap vaccine for administering in pregnancy to prevent pertussis or tetanus in newborns given to moms, false claims that those vaccines are being laced with human chorionic gonadotropin in order to sterilize women on the African continent. I mean, it's just horrific, right? But, without knowing a scientist or what a scientist does or what public health people do, people are more susceptible to that. So we have to be out there more, I think, and that's going to be a big job for us as we move into the 2030s.
Agree. I
If
feel
I,
like
if
risk
I
is a
may add,
very. Go ahead, Stella.
sorry, yeah, I was just going to add something to that. When we tell the goodness of vaccines story, I think we need to be very truthful about what we say. We should tell people that no vaccine, none, is 100% sure. No vaccine will prevent 100% of the people by 100%. And that the 1 or 2 percent or whatever it is that the failure rate is a reality, and that some people who would get this vaccine might not be immunized. People don't understand that, because somebody says, well, I've been vaccinated and I got the disease. How come? Well, because some people who have been vaccinated might get the disease. And it all depends on the quality of that vaccine. To change that mentality is very difficult. So, upfront, when we are educating about vaccinations, we need to tell people the real thing. This vaccine is X%, effective. Out of 100 children that we give, probably 20, 30, 10 will not be immunized. And if your child is one of those 10, honestly, then that's that will of God. That's where that will of God comes in, because you don't know who will not be immunized. But if we don't say that, and people come, with illness, then we've ruined everything. I needed to make that clear, because we see that on a daily basis. We want to impress people about the goodness of what we want to share. And it's just like becoming a Rotarian. I'm a Rotarian. And when you want people to become members, you don't tell them about membership dues. You don't tell them about the commitment they should make. You don't tell them about donations. You tell them what a wonderful thing it is to be a Rotarian. And then they become a Rotarian, and you ask them to pay district dues and RI dues, and you tell them to donate to polio, and you tell them to donate to A, B, and C, and they're not ready for that. So I think the truth upfront is very, very important.
Well, I think
You
this is
answered the
also
question.
going to.
Go ahead.
Sorry, I was going to say I think this is going to be an added role for Rotary. for a couple of reasons. I think now what you're seeing is tragically our very aggressive anti-vaccine movement that did so much damage during COVID and now spilling over to childhood immunizations. The US, we export our culture for better or for worse. We export movies, music, and now we're exporting our anti-vaccine movement. And I'm seeing it now in low and middle income countries, that same US style anti-vaccine rhetoric pop up on the African continent. We're exporting pseudo documentaries and a lot of pseudoscience as well. You're seeing it even in Latin America, which has held the line so well. And that's coupled with a major U.S. divestment from global health in terms of what's happening with USAID. So who's going to step up and do all those things? And I think, Rotary, the Rotarians are going to be very important more than ever, both for filling some of those gaps, but also taking on this very important added role for vaccine education, which you've already been doing for many decades successfully for polio. We're going to need it for the whole vaccine ecosystem. I've had the opportunity now to meet with my brother, Dr. Tedros, a couple of times at the World Health Organization. And each time, he already knows what I'm going to talk to him about, even as he sees me walking down the hall. And that is, Director General, I'm so sorry we're exporting our anti-vaccine movement to you, but that is the reality. And how do we begin now chipping away at this, especially in the low and middle income countries where we'll have so much damage?
Yep, Stella, you basically answered the question before I asked it beautifully. And so thank you for doing that. You touched on a topic that is, I think something we'll be working on for many, many years. And that's the concept of how hard it is to communicate the nuance of risk and hazard and even risk in comparison to benefits. It's, storytelling is one of the best ways we can get these messages across, but it's also storytelling and anecdotes that cause people to have hesitation and to have fears. And so I'd love if both of you can give me examples of effective ways that you have seen used to communicate the nuance of risk and hazard. I know, Peter, you mentioned, the infographics to kind of put to scale what would happen in large populations, but digging even deeper with that, because sometimes people can get a little bit data blind and the numbers kind of go over their head and they get overwhelmed. Can you both share an example of a really effective strategy to communicate that type of nuance? Tough question, but I'll start with you, Stella.
Peter, you start. You're good at starting.
All right. Well, I think there's a few things to think about. And we're dealing with this right now in our terrible West Texas measles epidemic, which was a completely unforced error. Our new numbers now are over 34 kids are hospitalized. We've had one pediatric death in Texas among an otherwise well school-age child who was whose parents decided not to vaccinate them. Just a horrific choice. And in my case, since I am trained as a pediatrician and pediatrician scientist, I tell firsthand of what it was like before the Hib vaccine, Haemophilus influenza type B vaccine became available, because I was there through the transition. So as a house officer in Boston in the 1980s, I was admitting children on a regular basis with Hib meningitis, and what a horrible illness it was in terms of permanent neurologic illness and deafness. In some cases, the child didn't survive, and watched as almost a miracle as the vaccine came online starting in the late 1980s. And within 5 years, when I had become an attending pediatrician at the university hospital, I was teaching about Hib meningitis like the old timers were teaching me about diphtheria or tetanus. That's how dramatic it was. And that is the power of the vaccine. And we need to get more and more of those stories out. As Stella began with, there's no more potent public health weapon than the vaccine. And we just continue to have to bring that home.
Yeah. I completely agree with him. I can't even think of any other example, to give. When people, if you have been in a community where they used to see lots of children in their community get paralyzed in their childhood, and you talk to people, and a chief or a village head or a quarter head tells you, wow, 10, 20 years ago, you would see our children not going to school because they're crippled, they're sitting at home. And as the years go by, you see less and less of this. And that people came here and put 2 drops in children's mouths. And we don't know how it works, but we can see the difference. The difference is clear. In 1988, when the GPEI was formed, there were 350,000 cases of paralytic polio that year. This year, we only have 2 countries that, and this is this year because last year was even less, but we have barely 100 cases in the 2 countries of wild polio. People, you can tell, you can see, you don't need to be told, you can see the difference. You can see the difference. But if on that one hand, we have such great work being done with wild polio virus, and when we talk about polio eradication now, I live in South Africa, which hasn't seen a polio case in 30 years. And you say people should continue donating to polio. And I said, polio? What polio? Polio is over. No, polio is not over. Just because it's not here doesn't mean it's not anywhere. And like we say in Rotary, polio anywhere is polio everywhere. So to tell people in South Africa to be wary about a disease which is not in their community, it's a little hard. It's a hard sell. But you've got to make people understand the world being a global village, that this child in Malawi, southern Malawi, who came down with wild polio virus in 2021 of a Pakistani strain, the child had never left the village before. How did it get there? That brings home the fact that the world is a village. Somebody came by air from Pakistan to Malawi. This child in a village who'd never left his village got ill, which
Yes.
means you can be sitting here in my neighborhood in Waterkloof in Pretoria, and we can come down with polio. So that message needs to go through. Polio anywhere is polio everywhere. Thank you.
Absolutely. I mean, vaccines are sadly a victim of their own success because when public health, when vaccines work, it's invisible, right? And I think amnesia might be one of the most deadly threats today because out of sight, out of mind. I think a lot of folks everywhere are saying, why are we vaccinating for diseases that don't exist anymore? Well, they don't exist around you because of the success of vaccines. So if you're talking to a parent today who says something like that to you, how do you justify, especially the large number of vaccines that children get today, which I think a lot of people have misguided perceptions about, but how do you justify the need for the multiple doses of multiple vaccines that children get as their kids? Peter, I'll start with you.
Well, I think one is to say we've heard your concerns, and one of the things that we have done is combined multiple vaccines into a single injection. So we recognize. I think the expression sometimes you hear is there's limited real estate on the arms of a child, so you don't want to keep on injecting a child, and we've heard that, and so look at what we have now, up to a heptavalent, 7-valent vaccines now for children, and that's been a huge advance. So it's gotten a lot better, and I think the key is to educate parents about what these diseases are and go through each one and explain, when you're administering the vaccine, why you're doing it and what this disease does and what it's done historically, but also how fragile the ecosystem is, the vaccine ecosystem, and how quickly these diseases can return. I mean, measles was eliminated in the United States in the year 2000, and now it's come roaring back. And that's what happens. And this is why we need constant vigilance, but also constant education as well.
I've got nothing to add to that. He's spot on. Thank you.
All right, so I have one last question for the both of you. As experts in your space, you have a unique role of being communicators and experts to share the message of vaccines and why it's good for public health. But what can you tell the average person who is watching this, who may want to know what they can do as a person to spread the information about vaccines, to spread the information about infectious diseases and public health? What is something you can tell them as they join this very collective work of public health? Stella, I'll start with
Well,
you.
okay. Um, I am the End Polio Now coordinator for Eastern and Southern Africa. That's 15 countries in Eastern and Southern Africa, and the region 28 of Rotary Zone 22. And for the last 3 years, my role has been to, promote polio eradication. We have polio plus chairs in each country, and I have found a very, not easy, but a memorable way of remembering what to do. And this, I talk to Rotarians as a Rotarian. Now I speak mostly to Rotarians. I'm retired from the World Health Organization. I don't practice medicine. I no longer teach in the medical school in the University of Pretoria. I'm a full-time Rotarian. And so my duty is to inform as many Rotarians as possible, and there are over 1.2 million of us in the world. In my zone, we are a couple of 100,000. I need to inform everybody about the facts about polio. They know that polio eradication was started by Rotary in 1985. Polio Plus was created. They know that the partnership was created in 1988, the GPEI. Now, they need to know more than that. They need to know where we are with polio eradication. They need to know where we started. We say we are 99.9% there. Where did we start? Every Rotarian needs to know where we started, because anybody can ask them. I'm wearing an End Polio Now pin. What is this for? They should be able to tell this disease we thought was a low hanging fruit. The world had eradicated one disease before smallpox. We saw something that could be eradicated. We went for it. And as partners, we are together in it. But polio, we were here in 1988. Today, we are here. There's vaccines for polio. They work, but we still have variant virus polio. Everybody needs to know a little bit about polio eradication. Then, knowing what you know, you need to share what you know. Anybody asks you, and I do a one-person show every year for World Polio Day. I work for polio in polio gear, and people stop me, what is this? And I tell my story about polio. Everybody needs to be able to tell somebody else what they know. And then lastly, you can't be a Rotarian and not talk about donation. We ask everybody to donate whatever they can towards polio eradication. And I've termed that LSD, the drug LSD. Well, don't think about the drug. My L is for learn, my S is for share, and my D is for donate. So remember LSD for polio. You've got it all. That's all I can
I
say.
love that. I love it.
Well, what I'll say is it's really hard to improve on what Stella just articulated, and I completely agree. But I will say this, it's one thing to hear it from someone like myself, who's a pediatrician and is working in an academic medical center. We can't rely on people like me to spread the message. There's just not
Mm.
enough of us, and especially now with the erosion of our vaccine system here in the United States, bringing back measles and pertussis and potentially, God forbid, even polio. Now we've got polio in the wastewater in New York. What do we do?
Mm.
And I think we need the entire population educated about this, and in addition to our K through 12 teachers, I think the Rotarians, as Stella points out, there's a lot of them, and we need them to really educate parents in the community about the vital importance of vaccinations. And polio is a great way to begin because of the dramatic nature of polio, paralytic poliomyelitis. But one opportunity, I think, is to build on what the Rotarians do for polio and to expand that to other vaccine preventable diseases, given that in some ways they are experts in vaccination. And we need our community workers or people out in the community, even if they're not healthcare workers per se, to be out there and educating all parents about the importance of these illnesses and the importance of vaccinations.
Wonderful. Well, thank you both so much for your time. I feel like we could probably talk for hours about this topic, but this was a wonderful conversation and a great way to celebrate World Immunization Week.
Thank you very
Thank
much
you.
for having us.
Yeah, it's a real honor for me to be on with both of you. Thank you for all your great work and the work of the Rotarians.
Thank you.
Likewise.
Thank
Thank you
you.
both.